What causes schizophrenia in women? What really causes schizophrenia in women? This question is important as it helps us understand how this mental health condition affects women differently. Schizophrenia is a complex mental health issue that impacts how individuals think, feel, and behave. In women, the causes are influenced by a mix of biological, environmental, and psychological factors. First, let's talk about the timing of onset. Women often experience symptoms later than men. While men typically show symptoms in their late teens to early 30s, women usually see the onset between their mid-20s and early 30s. Interestingly, there is also a second peak in symptoms after age 40. This difference may be linked to hormonal factors, particularly estrogen, which seems to offer some protection against psychosis. Genetics also play a significant role in the development of schizophrenia. Women with a family history of the condition are at a higher risk. However, it is important to note that having a genetic predisposition does not mean someone will definitely develop schizophrenia. Hormonal changes are particularly relevant for women. Estrogen levels fluctuate throughout a woman's life. When estrogen levels drop, such as during and after menopause, the risk of developing schizophrenia or experiencing a first episode can increase. This is why some women may first show symptoms later in life, sometimes after age 45. Environmental factors are another piece of the puzzle. Stressful life events, trauma, or significant changes can trigger the onset of schizophrenia in women who are already at risk. Factors like low socioeconomic status, living in high-stress environments, or exposure to certain viruses during pregnancy can also heighten this risk. Additionally, brain structure differences may exist in individuals with schizophrenia. Some studies suggest these differences can develop before birth and may interact with other risk factors. When it comes to symptoms, women may experience them differently than men. They are more likely to have mood-related symptoms, such as depression, and may have a later onset of the illness. Common symptoms include hallucinations, which are seeing or hearing things that are not there, delusions, which are strongly held false beliefs, and changes in thinking and behavior. Treatment for schizophrenia in women generally follows the same guidelines as for men. However, there is a growing recognition that hormonal changes should be considered in treatment plans. Some studies suggest that estrogen therapy might help manage symptoms in women, especially during menopause, but more research is needed. Supporting women with schizophrenia involves not only medical treatment, but also addressing life stressors and building resilience. Managing stress, maintaining social connections, and seeking timely help are all important for recovery and daily functioning. In summary, schizophrenia in women arises from a combination of genetic, hormonal, and environmental factors. Understanding these causes can help tailor support and treatment to meet the unique needs of women facing this condition.